In our first story, the Basic Education Certificate examination starts today across the country, and some 96 candidates from the Treponi EP Junior High School will be sitting for the examinations. And some of the candidates who fled the area following the conflict between the Chokoses and the Kokumbas are being accommodated at the examination center and also being provided with security. The headmaster for the school, Samuel Jare, says some students who fled as far back as January when the conflict broke out are back to sit for the first papers, with students having lost over 31 days of contact hours in school through the fighting. There are questions about their preparedness for the examinations. Mr. Jare fears some may not be adequately prepared psychologically, emotionally, and also intuitively for the examinations.
Some of our children who ran away, the other side, the Konkombes, the chief executive has arranged vehicles which has gone to all the hinterlands to convey them to the senior high school here. And he has given them security guys who are here.
Meanwhile, the West African Examination Council says all is set for the first papers to be taken later this morning. Agnes Kujo is the public relations officer.
We have 517,332 candidates who are taking part in the examination. These candidates are from 16,871 schools throughout the country, and they'll be writing the exam at 1,880 centers. All stationery have already been sent to the districts, and the supervisors have custody of these stationery. We've sent the question papers to our strong rooms at the various depots.
Okay.
And the distribution officers from the Ghana Education Service would go to the depots, pick the questions, and distribute them to the centers along their route. So everything is ready.
Moving on, the Commission of Human Rights and Administrative Justice, SHRAJ, is asking government to work towards eradicating poverty not only in urban Ghana, but in rural communities if it is committed to achieving the Sustainable Development Goals by 2030. Though the 2018 SDG Progress Report shows that extreme poverty has eased, there are concerns about the existence of worse forms of the problem in the hinterlands. In an interview with JoyNews at this year's network of national human rights institutions in West Africa, the Commissioner for SHRAJ, Joseph Whittal, said it will be misleading if governments with such poor records make declarations that they have completely eradicated poverty in their countries.
Globally, the number of undernourished people, according to the 2018 report on the Sustainable Development Goals, has risen from 777 million in 2015 to 815 million in 2016. The rising trend points to the fact that more needs to be done in the area of poverty reduction. Mr. Whittal tells JoyNews, addressing the issue of poverty eradication requires a comprehensive approach so that no one is left behind.
Ghanaians' rights not to be poor, to have food, to have shelter, to have clothing, which are basic fundamental rights of every person before you can really live a meaningful life. It's a necessity. So it's not ticking the boxes. It's about doing that, making sure that we have data. That's why they said leave no one behind. So if you even say you have halved poverty in Ghana, we've halved poverty, extreme poverty, and we can go and show gaps in, say, the northern 3 regions, in some villages where poverty is rampant, then your data is misleading.
Member countries that were present at the network have been urged to respect the fundamental human rights of their citizens if they are to give meaning to their commitment to achieving the SDG by 2030.
Meanwhile, in the Upper West region, its Deputy Regional Minister Amidu Chinya Isahaku has suggested the introduction of community services for persons who commit minor offences. He says the move, if adopted, would go a long way to reduce congestions at the prisons in Ghana and also save the country some money. He says the feeding grant, for example, given to prisoners is a drain on Ghana's economy and wants government to take a serious look at his suggestion. Mr. Isahaku made the statement during an education forum held for inmates of the WA prisons by Healthway Foundation. Here is Rafiq Salam's report.
One major challenge facing prison authorities across the country is congestion or crowding at the cells. Most prisons in the country hold twice the number of inmates required. Though the introduction of the Justice for All program has reduced significantly the number of remand prisoners, the issue is still more pronounced on the lips of prison authorities whenever they have an opportunity to speak about their challenges. The WA prison was constructed for less than 100 inmates close to 100 years ago. However, it has more than twice the number required. 211 is the total number. 179 of them are convicted, including 2 foreign nationals and 31 on remand. Commander of the WA prison, Deputy Director of Prisons, Christopher Nyemede, expressed worry over the crowding and inhumane conditions when non-governmental organization Healthway Foundation visited the prison to donate some food items and also speak to the inmates about personal hygiene and how to conduct themselves after they are released.
If you look around the type of structures we have and the numbers, it will have some kind of message for you. Indeed, we are stressed because there are a lot of structural deficiencies, bedding, cubic space per inmate, medical feeding challenges, because each inmate is fed on 180 pesos per day.
Deputy Upper West Regional Minister Amidu Chinya Isahaku suggested that one way of decongesting prisons is to introduce community service for people who commit minor offenses.
It's not about murder. It is not about fraud. There are some of the crimes by human nature they happen, and you can commit the people to community service, and then they'll still reform, and they'll contribute positively to the community. And government also even save money, because when you look at the number of people across the prisons in Ghana and you multiply the amount of money by the numbers, it is a huge budget problem on the government.
Lawyer Abubakar Mutiu of Law Temple told the inmates that they should not think per their current predicament they are condemned and not of any use for the society when they are released.
I am here today, I am not an inmate, but tomorrow I could be here. Every other person seated here could become a prisoner tomorrow. Does that mean that when I become a prisoner tomorrow and I come out into the society, I should have nothing to contribute to society? The answer is certainly no.
A view equally shared by Chief Executive Officer of Healthway Foundation and wife of Upper West Regional Minister Rihanna Hakim bin Sali.
Members of the societies should see your present state as temporal. We are calling on you to serve as a role model for the youth out there who still think engaging in crimes is best when you finally find your way out here. I implore you all not to be disheartened over the state of affairs in the prisons, because God has purpose for bringing you here.
Former WA Municipal Director of the Ghana Health Service, Beatrice Kumfa, advised the inmates to take their personal hygiene seriously. Reporting for JoyNews, Rafiq Salam. WA.
Now let's take you to the Ashanti region next, and health officials in the Bosome-Frehun district are appealing to government to establish a hospital to befit the status of the district. Well, they say such a facility will ease the suffering of patients and also reduce needless deaths and referrals of emergency cases to urban centers. District Health Director Clement Ntibuating spoke during a visit by the Member of Parliament for the area, Joyce Ajwa Akodei. Mahmoud Mohammed Nuruddin now reports.
The MP was on a visit to donate assorted medical equipment worth 120,000 Ghana cedis to various health centers in the area. Bosome-Freho district was carved out of Bekwai municipality 11 years ago, but has since been battling with challenges with such local government creations. Poor road network, inadequate medical facilities and staff, as well as accommodation, are some of the challenges. Mr. Ntibuating says patients, including pregnant women, sometimes walk over 20 kilometers to access healthcare services.
We have been looking for support to help us improve on quality of service in the district. Fortunately for us, Honorable Member of Parliament has been able to mobilize these items through the National Health Insurance Authority Fund to support us. So we are most grateful to God, most grateful to the Honorable Member for this support. And we are assuring the Honorable Member and all the people of this district that the items will take good care of them and put them.
The items included 2 refrigerators, 20 infant scales, 12 drip stands, blood mixer, 6 fetal Dopplers, 2 dressing sets, 12 adult weighing scales. Others were 2 delivery sets, 9 meal bags, 20 BP apparatus, and 2 multi-purpose printers, as well as 10 beds, 2 sets of office chairs, and a microscope. They were procured from the MP's Health Facility Development Fund. Madam Akodei acknowledges the challenges facing most parts of the district. She also appealed to the central government to take a second look at the poor road network and assist in that regard.
Roads in Bosome-Freho is deplorable. This is like a proper village setting, and we have a lot of prominent people hailing from Bosome-Freho. So I'm just pleading to the government to look at us again and help us to try and set up our hospitals, our road network, our schools, and everything that we need to survive as a group, because they're predominantly MPP. They are very crazy about MPP, and especially about Nana Akufo-Addo and myself. So that's why I'm doing everything in my power to try and help our people. Even the people who are in Bosome-Freho, who are NDC, they still love this government. They still love me, and they love Nana Akufo-Addo.
Mr. Ntibuating said a hospital for the district would be a big intervention in healthcare delivery while reducing the burden of overstretched staff. Mahmoud Mohammed Nuruddin's report for JoyNews.
And before we go, health personnel who accept posting to the newly created Amansia South District are assured of free accommodation in the capital, Dubia. We have the District Chief Executive, William Asante-Bediako, saying that through a community initiative, residents have put up homes to address personnel challenges in the area, which is one of the most deprived in the Ashanti region. Teachers, health personnel and other professionals, for example, have over the years refused posting to the area, citing poor road infrastructure, the lack of decent accommodation and social amenities, among many other reasons. Ohiminteria has more.
Amansia South District, which was carved out of the Amansia West District, has no public hospital. The Assembly's quest to upgrade the health center at the district capital, Adubia, into a hospital has received a boost as central government commits to expand the female ward into 100-bed facility. Construction of office complex for the district's health directorate and doctors' bungalow, funded from the district development fund and internally generated funds, has already been completed. Attracting teachers, health personnel and other professionals, however, has been difficult due to poor rules, accommodation and social amenities. Chief Executive William Asante-Bediako told JoyNews residents are taking up accommodation challenge. He wants the Ministry of Health to encourage personnel to take advantage of the gesture and accept to work in the area.
We want to make sure that sooner than later, this health center will be converted into a hospital.
That is our biggest aim. And the assurance is that government has decided to give us 100 capacity women's ward. And then we are also looking at other places so that they will come and assist us with a theater and a lab. So is that the Ministry of Health should encourage health personnel to come here. Because you can see today that the people are so hospitable. They feel the need for them to come here. And people are willing to give the accommodation for staff free of charge. And so they should try and come. The Assembly too has rented a place for the health directory staff. And so we want to appeal to the health staff to accept postings to Mansour Dubia. This is not a deprived area. This is a place where when you come, you see all kinds of first-class things happening around us. And so people should accept postings to this place. We are also ready to do whatever it will make them comfortable to stay and work for us.
Upper respiratory tract infection is the number 2 OPD condition in the Amasia South District, attributed to dusty roads in the area. Mr. Santive Diako says work on road networks will soon commence as the contractor move to site next month.
I want to assure the nurses and the general public that our roads are going to be tied sooner because it's been awarded and the contractor is just getting himself set to come.
From Mansour Adubia in the Amasia South District for Joy News, Oiminteria reporting.
And that's it for the news update. But we have more news as we look at what stories have been published on the front and back pages of the newspapers. We have a couple of them for this great Monday morning. We hope that you stick and stay. It's always live here on the channel. We're taking a break. We'll be right back with all these.